Ladies and gentlemen, Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Welcome to our series of lecture concerning the course Applied Pharmacomancy, and welcome to our sixth lecture of this course. The title ASEAN and Chinese Herbal Medicine. It is worth mentioning this course is designed for fifth year pharmacy student, faculty of pharmacy, and Alien University. At the beginning, as we know, the Chinese and ASEAN herbal medicine gained good reputation in China and in Asia in general and in Western countries. And Chinese herbal medicine also have good reputation and practiced practiced extensively in Western countries, and a lot of herbal medicine that are used in these two systems of traditional medicine are gain scientific evidence and are proved to be practiced in Western medicine. This lecture will talk about or capture some aspect of these two systems of medicine, including the principle of practice and the evidence base for Unani, Ayurveda, and Siddha as a series system of Chinese medicine, beside the same outline about the principles and practice of Chinese herbal medicine. On the other hand, the lecture spotlight on the efficacy and scientific evidence of Asian and Chinese herbal medicine. The objectives of this lecture can be summarized in 6 points. First of all, to introduce a brief historical background about the origin of herbal medicine in Asia, with emphasis on Chinese traditional medicine, and to highlight a physiological underpinning terminology known as yin and yang, or 5-element theory. The second objective is to identify the key herbal system in traditional Chinese medicine, and compare Chinese herbal practice with other ASEAN traditions such as Ayurveda and Kambu. Number 3, to classify major herbal categories that present in Chinese herbal medicine and explain their therapeutic indications and mode of action. In principle number 4, to discuss preparation and administration, and here we mean review traditional method of herbal medicine preparations such as decoction and pills and tinctures, and with emphasis to dosage form, safety, and standardization challenges that face herbal medicine. Objective number 5, to evaluate clinical applications by providing example of common herbal preparations for specific systems such as digestive, respiratory, and circulatory system. Beside common example for specific disorder, we assess evidence-based research supporting efficacy and safety of these herbal preparations. And the objective number 6, to highlight the global relevance and we mean by that, examine the integration of Chinese herbal medicine into modern healthcare system. Besides discussing regulatory and ethical and cultural consideration in global practice. This is the main objective of this lecture, ASEAN and Chinese herbal medicine. So in order to meet the previously stated objective, lecture of ASEAN and Chinese herbal medicine can be divided into two, or already divided into two parts. Part 1 speak about ASEAN medical system, including three ASEAN system, including Unani, Ayurveda, and Siddha. In this part, we speak about the common feature of these three ASEAN medical systems. And in this feature, we speak about the origin for the system, the principle, and practices beside regulatory status. The same thing for Ayurveda and Siddha. We discuss origin and the principle and the preparations or herbal preparation, herbal and preparation in Ayurveda. Also the same thing in Siddha medicine. We talk about origin, principle, practices, and drug classification. The second part of this lecture will talk about Chinese herbal medicine. The second part of the lecture is about Chinese herbal medicine, and in this part we discuss three main topics: historical background, therapeutic principle in Chinese traditional Chinese medicine, and evidence of efficacy, including clinical trials, clinical studies, regulatory attitude, and clinical trial in West, and safety concern beside case study for the uses of Chinese herb, which may be effective in certain conditions, certain chronic conditions such as childhood eczema, and we highlight the main evidence and main drawback of the use of Chinese herbal medicine in treating chronic diseases such as childhood eczema. In the first part of this lecture, we speak about ASEAN medical system, including the three systems Unani, Ayurveda, and Siddha. The common feature of these three ASEAN medical systems include the following. All the three systems emphasize a holistic approach for health, and another thing, this system focus on the balance of elements and humor in the body as a base for health, and all this system use for treatment using herb, minerals, and metals in as treating agent. And it is worth mentioning all these three systems are still widely practiced in rural communities of India and Pakistan. Now we speak in details about Unani medicine as a part of ASEAN medical system. Unani medicine, the origin of the word is from Arabic, known as Yunan. And the meaning of Unani in English means Greek. Actually, Unani medicine influenced by different cultures, and actually based on Hippocrates, Galen, Avicenna, and influenced by Greek, Islamic, and Indian medicine. So the principle of Unani medicine is a blend of different the origin or is rooted in different cultures, and the famous physicians in Unani medicine or having influence on Unani medicine, Hippocrates, Galen, and Avicenna. And the core principle of Unani medicine practice is based on that the body consists of 4 humors. One of them is belgam or balgam, and blood, dam, and yellow bile, safra, and black bile, soda. As we know that there are 4 words related to Arabic, having Arabic meaning, and these 4 humors is linked to temperament, which means the personal characters or the emotional nature أو الway of thinking بالنسبة للhuman أو الperson in order to diagnose its condition or the disease condition. And this temperament or person character is linked to these 4 humors, and divided temperament in 4 types: sanguine, phlegmatic, choleric, melano-choleric. Sanguine means linked to predominance of blood, and phlegmatic linked to excess of phlegm or balgam, and choleric linked to bile, excess bile, and melano-choleric linked to excess black bile or soda. Based on the previously mentioned, the 4 humor of the body as a principle in Unani medicine, and the link of these 4 humors to the temperament or the personal characters, the treatment used in Unani medicine openly used honey, beryl, and metals for treatment of the illness or the health disorder. It is worth mentioning beryls is or in Arabic lu'lu, classified as organic gem and isolated from marine organism, sometimes mainly composed of calcium carbonate. In Unani medicine, the beryl believed or considered to have cooling and strengthening and healing properties. So it is used in formulation to treat the hot conditions such as heart disease, eye disorder, and nervous condition. And beryl is usually or openly grounded or grinded and mixed with honey as carrier for treatment. And based on the current scientific research, honey recognized as having antimicrobial and antibacterial and healing, wound healing properties, which emphasize or confirm the use of honey in Unani medicine as a vehicle and as medicine. The regulatory status for Unani medicine in Asia and specifically in India, Unani system medicine is approved as system medicine or as practice, and the practitioners or the person who practice Unani medicine recognized as qualified doctor. The second type of Asian medical system is Ayurveda, and actually Ayurveda is purely Indian, and it is a very old traditional system of medicine, and it has 5,000 years old and rooted in Vedic culture. And the meaning of Ayurveda in Sanskrit language, Ayos means life principle, and Veda means knowledge. So Ayurveda means life principle or knowledge of life principle in Sanskrit language. The focus of Ayurveda in protecting Ayos or protect the life of principle through physical, mental, social, and spiritual harmony. Is the four elements that should be balanced in Ayurveda to restore healthy life: physical, mental, social, and spiritual harmony. And in modern science, the Ayurvedic practice increasingly tested within the clinical trials, and its popularity grown in West. There are some schools and treatment centers are emerging that using or practicing Ayurveda, and to some extent Ayurveda is similar to traditional Chinese medicines, specifically in its principle yin and yang in Chinese medicine, and tri dosha in the principle in Ayurveda. There is a similarity in these two core principles, which will be discussed later on in the next slide. In order to understand the principle of Ayurveda practice and diagnosis, we need to link or to spotlight on the Veda culture and Veda's books. And actually, Ayurveda is originated from Hindu beliefs, rituals, and religion. And Vedic culture means the ancient civilization and religion practiced by Hindu people in India. And the Vedas is known as the holy book, Kitab Muqaddas, and in Hindu or in Veda culture there are four for holy books. And on the other hand, the Veda religion or the Vedas book focus on three or four the natural forces of nature, including sun, rain, and fire. So, the Ayurvedic practitioner, based on its Vedic culture, and it is known as Abhayat or Ayurvedic practitioner, analyze the patient constitution, which is known in Hindu as Barakruti. Also, in order to obtain the complete image of the patient condition, the Ayurvedic practitioner analyze astrological factors. And as we know, Ayurveda or Vedic culture is linked to astrology, sun, fire, and rain. Also, Ayurvedic practitioner can analyze the karma, and the philosophical meaning of karma means action or work. Originate from Sanskrit, means action or work, and it means that the good action of the person can lead to positive outcome, and the bad action of the patient can lead to negative outcome. The fourth factor that should be examined by a Ayurvedic practitioner is to get a thorough medical examination as that carried out on TCM, and this medical examination includes the tongue appearance, urine properties, spit properties, sputum, and feces. This is considered as physical features or physical parameters for the patient. After examining all these aspects, physical features, astrological factors, karma, and constitution, the Ayurvedic practitioner can get the whole idea or the complete image of diagnosis for the patient condition. Getting the diagnosis picture of the patient based on patient constitution, medical examination, astrological factor, and karma. The treatment of disease in Ayurveda based on use of complex treatment regimen, treatment doses, and the main objective of this complex treatment is to maintain or to rebalance the three bioenergetic forces that govern the body and mind, which is known as Tridosha, which consists of three types of doshas. The first one is Vata, which means air, Pitta, which means fire, and Kava, which means water. And as we mentioned previously, the Ayurvedic term and practice is linked to Vedic culture and Vedas, which focus on the religion which focus on fire, air, and earth. So Vata means the energy of air, and Pitta means the energy of fire, and Kava means energy of water. The balance of these three doshas, can be achieved through either through diet or through herbal treatment or exercise. As we stated in the previous slide, the main objective of treatment in Ayurveda, after getting the picture of diagnosis or the correct picture of diagnosis, is to make balance of the three tridoshas through diet or exercise or through herbal treatment. The three humors of human body, as we said previously, known as tridoshas, tridosha known as three humors or basic forces that manifest in human body and mind, and they are formed and the three tridosha. Each tridosha or each dosha from these three tridosha consists of 5 bhutas and are known as vata, which means air, and ether, pitta, which means fire and water, and kapha, which means water and earth. These three doshas are fundamental energy or humors that govern or control the body and mind, and each dosha is considered as combination of natural elements, such as fire and water, air and ether, water and earth, and so on. And each dosha have a distinct quality. The three tridosha govern all functions of body and mind, and by understanding the relationship between them, Vyad may make a diagnosis of the disease affecting the patient. By understanding the relationship between these three doshas, the Ayurvedic practitioner can be able to diagnose the disease. And the bhutas or 5 basic elements of Ayurveda, including space or ether, air, fire, water, and earth. The 5 bhutas constitute each doshas, which the 3 of doshas known as tridoshas, or the 3 humor of the body. Each dosha consists of 5 bhutas, and the 5 bhutas include space, air, fire, water, and earth. These bhutas are seen as manifestation of energy and can be equated to 5 senses, including hearing, vision, touch, taste, and smell. So through understanding and make relationship between the bhutas and the tridosha, the Vyad through his experience can get or can make diagnosis of the diseases that are affecting the medicines or the drug used in Ayurvedic practice. Mostly use herb, and the herb is administered to patient with the disease in different traditional form, maybe as tincture or inhalations, pills, capsule, or powder. And this herb also may be incorporated into the diet in prescribed ways. And as we stated previously, the treatment to maintain optimal balance of the tridoshas through herb treatment or diet or exercise. And the herb is the main or the most used, mostly practiced treatment in Ayurvedic medicine. One of the herbal medicine commonly used in Ayurveda is Razania, Razania herb. And Razania in Ayurveda means the bath of cells, and considered as a rejuvenating therapy that aim to enhance longevity and vitality and immunity as immune enhancer or vitality enhancer. Actually, Razania is a mixture of herb used in Ayurveda, and one of the most important herb used in Razania is Vidania somnifera, which is known as ashwagandha, and the part used of ashwagandha is the root. And the role of Razania herb in Ayurveda medicine is used to considered as having positive effect on health, and known in Ayurveda as Banasias. Banasias means having positive effect on health, with diverse actions affecting many systems of the body. The recent or method research finding concerning the Zani herbs, they found this herb having antioxidant activity, protecting all cells from damage, and immunomodulating effect, supporting and regulating the immune system, and having other beneficial biological activities. So the scientific finding confirm the use of Razania complex mixture of herb in Ayurveda to enhance immunity and enhance the vitality and longevity of the body functions. As we know, or as we note with Razanias, a mixture of herb used by Ayurveda, the preparation of Ayurvedic medicine based on the complex combination of herb together for treatment or for correction of body condition. And Ayurveda use Razanias and many other herbs as medicine. Although the clinical studies for some herb may be limited, but Ayurvedic practitioners emphasize the combination for synergistic effect. The Ayurvedic practitioners emphasize the use of complex mixture of herb because these herbs are working synergistically to producing effect. So the formulation principle in Ayurveda based on synergism, or sometimes opposition, and sometimes enhancement, or protection, or balance. So the aim of formulation either synergy or opposition or enhancement effect or protection or the balance of effect according to the diagnosis image that made by Ayurvedic practitioners. Again, with link to Razania hair formulation, the philosophy of preparation in Ayurvedic medicine is based on the emphasis or concentrate or focus on the whole formula. That means the herb in the formula are producing synergistic effect or a balanced effect rather than focus on individual substances. So the natural attribute of ingredient are combined to enhance overall action. And in Ayurvedic practice, the traditional herbal formula having a name that reflect scientific herb combination, the major ingredient, the sage or the practitioner who devised them, and therapeutic action or plant part used. As again with lasagna, the name reflects the type of herb that compose the formula, and beside the type, the major ingredient, and the practitioner who make the formula, and the action of plant part, the action and the plant part used. In this slide, there are a summary of important herb used in Ayurveda and their uses, including their botanical name and Ayurvedic name, the effect on the dosha, the humor or the energy of that affect the body and mind, and the medicinal use. For example, the botanical name of sweet flag is Acorus calmus, and its Ayurvedic name Vaka, and the effect on dosha, it acts in Vata and Kava and pacifies them. Pacifies means produce calming effect or reducing its effect. So according to its effect in dosha, Acorus calmus used as a nerve stimulant and digestive. And the same effect and medical uses are listed on the remaining herb in the list. The third type of Asian medical system is Siddha medicine. And the origin of the word Siddha from the Tamil word Siddhi, which means achievement or perfection. And the Siddhas in Tamil means holy figures who reach a highest level of physical and spiritual and intellectual mastery, mastering physical, intellectual, and spiritual skills. So the origin of Siddha medicine is originated to or linked to Tamil system, Tamil language. Siddha medicine is developed by 8 Siddhas, and as we said, the Siddhas, the holy figures or the regal man who reach higher level of mastering spiritual and intellectual skills. And they believed that the 8 Siddhas or the eight holy figures developed the Tamil system of medicine, or Siddha medicine. And these eight Siddhas are led or led by another figure known as Siddha ISTR. Siddha ISTR is the leader of eight Siddhas who developed Siddha medicine, and the name is derived from his name. The Siddha is written in Tamil language and also practiced in Tamil speaking regions. Briefly, the principle of Siddha is similar to Ayurveda principle, and they suppose that a universe and body composed of five elements, including earth, water, fire, air, and sky. So the treatment and health depend on the balance of the three humors of the body, and the seven tissues and waste product. In order to be in healthy state, we need the balance between these three aspects: three humors, seven tissues, and waste product. With regard to the practice in Siddha medicine, the recipes or formulas are recorded on palm leaf, which is written by ancestors and transferred through time to the new generation. And similar to Ayurveda and Unani medicine, in Siddha medicine they use plant part, mineral, metals, and animal substance for treatment. On the other hand, the unique features of Siddha medicine compared to the other Asian medical system is the use of metals, such as gold, silver, iron, and mercury for detoxification of metals, and make them used for treating stubborn diseases or chronic disease or untreated diseases. So the drug in Siddha classified into four major groups. The first group consists of 25 types of alkalis, and the second group consists of 64 minerals, subdivided into 32 natural and 32 man-made. The fourth class consists of metals, including gold, silver, copper, tin, lead, and iron. And the last group consists of mercury and sulfur, are widely used. And based on the literature, mercury is used in Siddha, reported to be used in Siddha, and sulfur also widely used. The second part of this lecture is about the Chinese herbal medicine, and Chinese herbal medicine has a strong traditional and clinical base in China, widely used in tradition, and a lot of clinical trials carried out on Chinese herbal medicine and validate their efficacy and safety treatment of several diseases. Although in Western regulatory system, the use of Chinese herbal medicine remain very less due to the lack of controlled clinical trials and due to the safety concern for some herb used in traditional Chinese medicine. Also, the botanical medicine is considered weak in according to Western regulatory system. On the other hand, Chinese herbal medicine has wide acceptability in United States and mainly in California, while in other Western regulatory system, Chinese herbal medicine is still skeptical. As we stated on the previous slide, Chinese herbal medicine receive a good or a high acceptance in China, and clinical trials on China are very common on Chinese herbal medicine. And the Chinese herbal medicine is a very old system of medicine, maybe 5,000 year old, and in 1977 the Chinese authority have released a comprehensive materia medica on herbal medicine or Chinese herbal medicine, and this materia medica contain about 6,000 herbs. Also in 1985, Drug Administration Law of China also highlighted 8,800 patented herbal medicines that require reassessment. And lastly, or recently in 1994, again the Chinese authority released essential drug list or established essential drug list, and this essential list includes about 1,700 herbal preparation, and approximately about half of this amount of herb are eligible for health insurance coverage. And this background indicates that Chinese herbal medicine could receive a higher acceptance and attention of the health authority in China. Before we speak about the importance of Chinese herbal preparation of herbal drugs, we need to speak or discuss about principles that govern traditional Chinese medicine as a source or as the system from which the medicinal herb or Chinese medicinal herb are rooted. At the beginning, the focus of TCM or traditional herbal medicine, Chinese traditional herbal medicine, TCM is developed without modern technology for isolating pathogens. The development of TCM has its own route and its own pathway away from the modern technology for isolating pathogens. That means the TCM principle have very strong and higher level of practice in China. The focus on illness through its broader impact and association rather than a specific disease entities. And again, based on the TCM principle, the understanding of or the explanation of illness or diagnosis based on the broader impact of the disease on the body rather than the specific isolated pathology. So the goal of treatment in Chinese herbal medicine or traditional Chinese medicine seek to avert harmless influence, try to treat or to relieve the symptoms of the diseases. And on the other hand, the goal is to promote healthy body functions to help the person resist or eliminate illness. So interaction is with the body function, not directly with pathogen. Again, this similar to Asian medical systems, which focus on or believe that the treatment is a holistic approach for treatment to make a balance between all the body functions rather than isolating diseases or through which is occur in modern medicine. As we said in the previous slide, the traditional Chinese medicine practice is still skeptical or doubting in West, except in California, because it's difficult to be understandable, and the complexity of treatment that used to alleviate the conditions. And one of the important concept in central concept in Chinese traditional medicine is yin and yang concept. And although the complexity of Chinese herbal medicine, a lot of beliefs or a lot of rules that originate in Chinese medicine are explained on the basis of modern scientific science, and it is aligned or agreement of experiment that carried out by or carried out on modern scientific basis or rules. So the concept yin and yang is criticized as speculative or as theoretical substitute for empirical data. And in order to understand the yin and yang, should be considered as tool for classifying a constant change. And as we know, in the life phenomena or natural phenomena, there is no constant state, but it's still it is always in constant or continuous change. And the better understanding for yin and yang concept is on the basis of physics theories or in dynamic system law. And as we know, we have two types of forces in dynamic system, or two phenomena: chaotic tendencies and ordered tendencies. chaotic بالعربي هي النزعات الفوضوية في الأنظمة الديناميكية، والordered tendencies النزعات المنتظمة في الأنظمة الديناميكية. Yang in Chinese herbal medicine, known as active, dispersive, centrifugal, transformative, expansive system or expansive phenomena. And the best fit for yang is chaotic tendencies. قلنا الchaotic tendencies هي النزعة الفوضوية، واليانغ هي أيضا تشبه النزعة الفوضوية. طيب, to understand the yang, the yang phenomena or yang force, in the dynamic system, the chaotic tendency is unpredictable and random pattern of behavior when the system is exposed to a specific stimuli or specific condition. And the best example for chaotic tendencies is the weather and human physiology. When the weather or human physiology is supposed to slight imbalance or small change in temperature, the change in symptoms in human body may be unexpected. When the system or the body is exposed to external pathogen, for example, for influenza or rhinitis, and the human physiology react unexpectedly, releasing neurotransmitters, higher fever to combat the external body. So the yang is active and dispersive force in exposure to slight change, while the yin is opposite to yang. It is substantive, nourishing, centripetal, sustaining, and preserving force for preserving phenomena. And the yang is similar to ordered tendencies, in which when exposed to slight change, the behavior should be stable, regular, and predictable. And the best example for the yin or the tendency is homeostasis mechanism. The homeostasis mechanism for human body when exposed to slight change show ordered despite maintain ordered despite external influence. Reaction for homeostasis is typical for ordered tendencies in dynamic system, while chaotic and yang is similar to human physiology or weather. When a slight imbalance may cause unexpected shift in health or energy. So, in traditional Chinese medicine, there is two forces or two phenomena, yin phenomena and yang. Yang considered as active and dispersive and similar to chaotic tendencies in dynamic system, while yin is substantive or nourishing, and substantive means practical and similar to other tendencies or similar to homeostatic mechanism of the human body. So based on yin and yang theory or concept of TCM, and yin known as chaotic tendencies, and yang similar to ordered tendencies. So according to TCM principles, the life at the end of two choices, the yin and yang. So in order to balance or to rebalance the life of patient, the TCM practitioner need to balance between static tendencies, static order, or turbulent choices to maximize adaptability and creativity. So the Chinese practitioner or physician need to restore body balance, the yin tendency, nourishment, and yang tendencies, and it's known as activity or the active choice. And he achieved this aim through a balance of clinical symptoms and not an abstract philosophy. That means the prediction of yin and yang can be predicted on symptoms, and accordingly Chinese physician need to oppose these clinical symptoms to restore the body balance and to restore life to ill patient. So to understand the yin and yang polarities, the two polar, and we know, as we said previously, yin is non-allostatic chaos, and yang is turbulent or active charge. And the TCM principles, the phenomena are always shifting in time and space. And any phenomena is not as one base or as static base, but it's static in a static and dynamic system. And to some extent, this principle is coincide with the physical principle and medical in physics or in natural physics, which know that systems are always dynamic. But there is a simple or minor differences in understanding of dynamic and static system or phenomena between TCM and Western or modern science. And here's an example for to differentiate between the yin and yang concept or description of phenomena or polarities between the TCM and the West or as modern science. For example, in the West, the table is an object. It is fixed and substantial, jawhari, or static or static charge. While in China, the table is seen not as static or fixed or object, but is considered as transitory or transitional yin base. And yin is static base with the active yang base relationship. That means there's transformation. In other words, the Chinese consider the table is not fixed, but as a table in shape of table, when it's made table, considered as a transitory static vase, because the origin of the tree is the origin of the table before to become table is a tree. So there is a transformation from tree to table, as transformation considered as active or turbulent chaos, and the another condition when it's formed as table by the intrusion or by invention of or by the hand of man, it can be converted to table. In summary, there is some differences in the concept of static and turbulent chaos based on this example of the table. The table in West considered as static and substantial, while in China the table is considered as transitory yin vase, transforming from active yang vessel here in the form of tree. After we discuss the core principle in TCM, the yin and yang principle and polarities, and they considered any phenomena or any system is in a dynamic system or dynamic phenomena can be transformed from active to inactive or static state. In this slide, we need to spotlight on the diagnosis and treatment practices in TCM. Actually, the illness, according to TCM, may stem from excessive activity or turbulent chaos, yang, or result from static or congestion activity, which is known as yin. The both states can produce diseases, maybe yang or yang activity can produce disease, and yin activity can produce disease, which represented by congestion. So the treatment strategy differ according to the condition of disease. Is it yin or yang? So calming or nourishing for yang excess, and stimulating or mobilizing for yin stagnation. In other words, if the region of disease is yang, that as a result of turbulent chaos or excessive activity, the treatment is opposite. You need to restore the calmness and to nourish the body to treat the disease. While if the disease results from stagnation or due to yin activity, such as congestion, the treatment is opposite to oppose this situation by stimulating or mobilizing the body fluid. Other polarities also can be considered besides yin and yang, hot versus cold, and internal versus external, and deficiency versus excess can be used to describe or to diagnose the disease state. Chronic diseases seen as pathogenic influences penetrating deeper, so best treated at the first stage to prevent embedded pathogenesis. In other words, in TCM, to treat the chronic disease that took a long time, they started to treat the surface symptoms or surface stage of the disease, and stepwise they can try to treat the other pathogenesis or the other symptoms, because in chronic disease the pathogenic can influence and penetrating deeper in the tissue because of time course or time frame. The another important concept in treatment, in diagnosis and treatment, according to TCM, is the vital energy or Chi. The vital energy or the energy or underlying energy in all phenomena, according to TCM, are not measured by calorie or as electrical energy, but can be judged by experience and defined as outcome or event. So the concept of energy measurement in TCM based on the event that produced or the outcome produced. In other words, as they consider the system are dynamic, their constant transformation of energy from yin and yang aspect and vice versa. Accordingly, physiologically, fluids are subdivided into fluid of different tendencies. For example, the blood, known as one of the body fluid, the blood, is known as Zeo, according to Chinese language, is considered as yin aspect. The blood is yin aspect, that means it's static chaos or static tendencies. So both physical and experimental, such as warming and nourishing. All these are the feature of yin aspect. So the herbal medicine considered more effective than acupuncture in moving the blood or zi. So in order to move the blood, what we consider as yin or static aspect, in order to move the yin, you need to use herbal medicine instead of using acupuncture. So the Chi summary of this slide, the vital energy is measured by event, and system is dynamic, we transfer from yin and yang condition, and the blood as one of body fluid, or known as Zeo, considered as yin, and if we need to move it, we auto activate it using herbal medicine or Chinese herbal medicine to bring it from yin to yang state. Another aspect that's important for diagnosis and treatment in TCM is the organ function. The body organ or the vital body organ is responsible for a specific physiological activity. And according to TCM, the liver, known as GAN, it is responsible for energy distribution, govern muscle, control muscle, its nose, eyesight, and the liver affected by anger and frustration. The other organ is spleen, known as bile. responsible for digestion, tissue integrity, circulation, emotional stimulation. So it is empathy and nurturing or protecting. We consider that as yin. The organ function extended across physical, emotional, psychological, and social level, resonating with fractal pattern in complex system. So there is interrelation between the organ function and the other psychological and physical or emotional behavior, as they appear in spleen and liver, can be affected by anger and by emotional stimulation. As we stated on the previous slides, herbal medicine, besides exercise and diet, are used to restore the balance of the body state, or to change the condition from yin to yang, or vice versa. Here is the way of classification of herbal medicine used as remedy in TCM. And according to TCM, herbs are classified based on two facts: based on their effect on the body manifestation, and classified by taste. The taste may be bitter taste, or sweet taste, acrid taste, salty or sour taste. In fact, in the Western system of medicine, or in the base of modern science or modern pharmacology, modern pharmacology supports some traditional conclusion about plant constituent. That means active constituent used in herb, used in TCM, is identified and supported by modern pharmacology, and confirming the effect of this constituent in TCM practice. Here below is some example of Chinese herb that gain acceptability and used in Western system of medicine, and classified by their traditional site of activity, rooted from traditional Chinese medicine. Here there is 3 examples of class herb. Herb that classified as warming remedies, releasing sterile condition. The second class, cooling remedies, releasing sterile condition, and the third class is bergeric. For example, for warming remedies, ephedra seneca or Levanta ephedra, part used is here, and its therapeutic activity on the body can be manifested as diaphoretic, anti-asthmatic, and diuretic. And the main constituent is ephedrine and its related alkaloid. So they confirm in modern pharmacology, ephedrine is the main alkaloid, abusive alkaloid in ephedra, and can produce the stated action as anti-asthmatic and diuretic effect. The example from the second class, the cooling remedies, is Mentha arvensis or peppermint, and the part used, the whole herb, and Mentha arvensis used as febrifuge to relieve fever. That means it has cooling effect on the body. The active constituent of essential oil is menthol and etc. And all these constituents are known of their cooling effect. The third class example is Reem palmatum, rhizomatal round. The part used is the root of Reem or its rhizome. And as we know, the action of Reem contain anthraquinone glycoside, can reduce laxative and calorific and detoxifier effect. So later on, the active constituent identified in Reem palmatum are anthraquinone, including Rene and amidine as anthraquinone aglycos. In this slide, we will speak about excessive bowel activity condition, or as the abnormal condition of that occur in human body, which is known as excessive bowel activity or irritable bowel syndrome in modern pharmacology or modern pathology. And the aim of this example is to compare between the diagnosis in TCM and in modern medicine, and to get understanding how the TCM practitioner applies their knowledge about the principle of TCM to diagnose the medical condition. And as we know, the modern physician who practices the Western medicine diagnose the IBS as dysentery or as diverticulitis. The modern physician diagnose the excessive bowel activity as diverticulitis, or the inflammation of the bushes or the diverticula on the wall of colon, or as dysentery due to infection by bacteria or amoebic dysentery bacteria. And this is because due to presence of blood on the stool. And also the modern physician explain or diagnose the fever tangible issue as irritable bowel. Also, the excessive bowel activity associated with fever and blood. The modern physician, as they said, the presence of blood in stool maybe due to the dysentery or due to diverticulitis, and the fever, symptom fever that suffered by patient with bowel activity as irritable bowel, the abnormal activity of the bowel, or peristalsis of the bowel. In contrast, the TCM physician assess symptom quality in general for excessive bowel activity, assessing chronicity, duration of symptoms, severity, correspondence, and attributing cause to diet that causes symptoms, the emotion, the debility of the general condition for the body, is it weak or strong, cold heat balance, or damp heat. The TCM check all these qualities: physical, emotional, psychological symptoms to assess the condition. Based on the history taken by TCM physician, the presence of blood or mucus in stool explained or diagnosed as deep-seated yin disturbance. And as we know previously, the blood is classified as yin state, and or also known as Zio, as yin state. So the presence of blood in the mucus due to excessive bowel activity indicate deep ctDN disturbance, which require nurturing treatment or protecting or nourishing treatment. Here is a detailed comparison between TCM and modern medicine concerning the case of excessive bowel activity. And in summary, the diagnostic approach for the case by modern medicine is identified as diverticulitis or dysentery, while in TCM tend to or try to assess symptoms, qualities, chronicity, severity, and correspondence. Another aspect of comparison is the handling non-specific symptoms. Symptoms not specific or general for the case. Non-specific symptoms for in modern medicine or modern medicine practitioner considered non-specific symptoms as labeled as less tangible issue as IBS or irritable bowel syndrome, while the non-specific symptoms such as fever, according to TCM, attribute causes to diet. There may be the cause of non-specific symptoms such as the fever, maybe due to diet or the emotional disturbance, or to debility or cold heat imbalance or damp heat. The interpretation of stool size, the presence of blood in stool, in case of IBS. The in modern medicine, they consider the stool signs such as blood and mucus due to infection or inflammation or due to cancer. While the blood in stool, according to TCM, they indicate that the deep-seated yin disturbance. The presence of blood, according to TCM, due to yin disturbance, and the treatment require nurturing care, protection or nutritive treatment to yin disturbance. For treatment, the modern medicine focus on the target pathogen, inflammation, or structural abnormalities. Treatment focus, according to modern medicine, to eradicate the pathogen and inflammation or structural abnormalities. While the focus of TCM to restore balance, to nourish yin and harmonize internal energies. So the underlying philosophy for diagnosis and treatment, according to modern medicine, they consider the disease as a discrete entity caused by identified or identifiable factor. The disease is caused by non-identifiable factor or factor that can be identified. While in TCM, the philosophy of disease or the illness is a dynamic imbalance influenced by internal and external forces. Imbalance between yin and yang. As treatment, you need to change or to transfer the yin condition to yang to restore the body balance. Now we speak about the evidence of efficacy in Chinese herbal medicine, both in China and in Western countries. The evidence base about Chinese herbal medicine. In China, a condition in China, there is a large body of clinical and experimental studies published in China. While in Western countries, fewer experimental studies and clinical trials is conducted. And the reason for the fewer studies or the less acceptance of Chinese herbal medicine in Western countries is that many Chinese studies historically uncontrolled, also improving. Many studies are uncontrolled historically. The other things, the Western regulatory agencies, especially in North America, Australia, and Europe, do not accept Chinese data for licensing medicines for the same reasons. They consider Chinese herbal medicine as doubting or skeptical due to the lack of rigorous studies carried out on Chinese herbal medicine. So, agency, the regulatory attitude of Western countries about Chinese herbal medicine remain doubtful of Chinese herbal remedies, but the pharmacological potential is accepted or accredited for pharmaceutical development, not for registration and practice, but for pharmaceutical development. And again, the general discomfort or the lack of confidence about TCM and Chinese herbal medicine stem from the lack of pharmaceutical precision in herbal remedies. And in most Western countries, Chinese herbalists lack the endorsement, not accepted in most Western countries. The only exception is in California. They register the Doctor of Oriental Medicine or MDs and allow legal prescription of herbal remedies and conduct exam covering 300 herb. Besides the discomfort or the doubting of regulatory authorities in Western countries about the efficacy of Chinese herbal medicine and the herbal medicine practitioner. Also, the clinical trials that carried out on Chinese herbal medicine in the West are rare and insufficient. So, there are other reasons that rooted behind this discomfort about Chinese herbal medicine in Western countries. The rare and insufficient clinical trials carried out on herbal medicine, Chinese herbal medicine. And the strong evidence required to show effect beyond placebo. So further trials are required, or detailed trials to support or to show effect of drug beyond a placebo or in low doses. And on the other hand, placebo effect is significant in mild condition treated by Chinese herbalism. Also, the placebo effect is significant in mild condition treated by Chinese herbalism, while the placebo effect is insignificant in Western medicine theory and principle. So, the trials on clinical trials on Chinese herbalism face a lot of challenge in Western countries. For example, they need for large and conducted studies, and lack of potentiality, and low investment return, skepticism of ethics committee and visitors. So these are the factors, 5 factors that face clinical trials in clinical trials on Chinese herbalism to overcome skepticism. The one factor, or the first challenge, is need for large and well conducted studies, and lack of potentiality, and low investment return, and the skepticism of ethics committee and physician by themselves. Another important issue concerning the evidence of efficacy for Chinese herbal medicine in Western countries is the argument of efficacy versus safety concern. We need to balance between efficacy of herbal drug and the safety, and we know the efficacy or the clinical traits that face assessing the efficacy of Chinese herbal medicine. Again, the safety also faced by some challenges, and as we know, any pharmacological effect implies possible toxicological risk. Any pharmacological effect may be associated with toxicological risk. But in general, for herbal remedies, the proponent argue, or the people who support the use of herbal medicine or natural products, they suggest that plant remedies, due to its complex nature, balance the effects through complex interaction and reduce the risk. And this group of people support the safety of herbal medicine, and when compared to synthetic drugs, and due to the complex nature of herbal drugs, they have less side effect or less toxicity. But the clinical experience show little evidence of acute severe effect. Clinical experience that use herbal medicine, they confirm that there is little evidence of severe side effect or acute side effect, but the toxicological effect still, or toxicological evidence remain circumstantial, or remain related to particular condition or particular details. The last issue related to evidence of efficacy of Chinese herbal medicine is our discussion about case study for the use of Chinese herbal medicine to treat eczema. And this case study about eczema trial published in Lancet journal in 1992. And in this clinical trial, it's considered as controlled study showed positive result for Chinese herbal mixture in treating resistant childhood eczema. Successfully, Chinese herbal medicine mixture succeed in treating childhood eczema, chronic or resistant childhood eczema, which considered as resistant to response for the treatment of all the in other words, Western medicine failed to treat the chronic childhood eczema. And as we know, the eczema is a disease condition that affects the skin, as appear in this picture. But the author of the trail suggests another issues regarding these clinical traits. The author advised to strict monitoring for liver and kidney function every 6 months to assess their safety for liver and kidney, a restriction for women of childbearing age, and caution for patients with jaundice or alcohol abuse. These are the 3 precautions advised by the author of these clinical traits. One of precaution, the first precaution is assessment liver and kidney function every 6 months, a restriction of use of Chinese herbal medicine to treat eczema in a woman of childbearing age, and caution for a patient with jaundice or alcohol abuse, because this herb may affect liver or kidney function. And another remark about the trail, they said that it is important to note no follow-up studies conducted because of the lack of follow-up studies. So it is impractical to develop licensable medicine from the formulation. And this may indicate that the less enthusiasm of the author to license Chinese herb medicine for treating eczema due to the lack of follow-up studies. But anyhow, the Chinese herbal medicine is succeed in treating childhood eczema in spite of the failure of Western medicine to treat the condition. Although they state some precautions for the use of this herbal treatment of childhood